Welcome back to Cancer Buzz. I'm your host, Summer Johnson. CAR T-cell therapy is a potentially life-saving treatment for certain patients with hematologic malignancies. But understanding how to identify eligible patients early can better prepare community cancer programs for the widespread use of this therapy. Our guest today believes community oncologists can play a key role in identifying eligible patients and getting them referred for evaluation. He has an easy-to-remember acronym to tell us about. We're joined by Dr. David Porter, Vice President of the American Society for Transplantation and Cellular Therapy, and the Director of the Cell Therapy and Transplant program at Penn Medicine. Ongoing collaboration and education for providers and patients is critical when treating medical conditions that are complex and dynamic, like certain types of blood cancer. And that's where letschatcart.com comes in. It's a resource for patients and caregivers to understand CAR T-cell therapy. On letschatcart.com, you'll find easy-to-understand explanations about CAR T-cell therapy and content designed for different learning styles, like videos and written materials, among other tools. Plus, the ability to chat with other patients with certain blood cancers and their caregivers about their CAR T-cell experience. Share letschatcart.com with your patients today.
CAR T-cells have revolutionized, I think, an approach to cancer care and certainly large B-cell lymphoma. It is a completely different new modality that for many patients has dramatic results when nothing else is working. There are patients who have failed just about every treatment option, and CAR T cells have been just dramatically effective. Of course, it doesn't work for everybody, but there are a few things we know, and I think most importantly, we know that there are many patients out there who could benefit from CAR T cell therapy who never have access.
The group developed an acronym to remember the parameters of referral to CAR T-cell therapy for these patients. Walk us through that, if you will.
So we had a number of stakeholders around a table and did a lot of brainstorming and came up with what we thought was a clever acronym that people might remember. The single most important thing for a patient out in the community at a place that doesn't have familiarity or immediate access to CAR T cells is to refer them somewhere that does and refer them soon and timely. And so the tagline we came up with was, if they recur, you should refer. And I think that's the number one important thing. If a patient has large cell lymphoma and they relapse or recur, refer them to a CAR T cell center. If the experts say it's not appropriate or there's other therapy, that's totally fine and that's a good opinion. But the sooner they get there, the sooner they get into the system, the more accessible it is to the patient and the more likely it is to be effective. So if they recur, you should refer. And recur turns out to be an acronym. The first R stands for relapsed and refractory large B-cell lymphoma, that any patient who relapses should be referred to a center with expertise for at least consultation. The E was for every age and comorbidity. We found that there's preconceived notions out in the community. Both patients have preconceived notions, their families do, but also referring physicians that, well, they're too old for CAR T cells, or they have certain comorbidities, and so they'll never be able to get CAR T cells. As we have learned more and more about these therapies, they've become safer, and there is no absolute age cutoff. It is true that the older patients get, they may be more difficult to handle certain toxicities, comorbidities may increase some of the risks, but there really is not an absolute age cutoff or a comorbidity that is an absolute exclusion.
So the word to remember is recur. We have the R and we have the E. What does the C stand for?
The C in recur stands for caregiver support. Patients who are referred into a CAR T cell center Should they be treated as an outpatient or discharged from an inpatient episode of care and need to stay near the treatment center, are required to have a caregiver with them. And that is a barrier. Not everyone necessarily has a caregiver who can be with them 24/7, let alone pick up and move to be near the treatment center. And so that should be discussed with the patient early. They need that support person through the whole continuum of care through their journey. The U of recur stood for urgency, to recommend consult. And it's a theme I keep coming back to. Refer them early. Don't necessarily say you're going to treat them for the relapse and we'll see how they do and then we'll think about it. There's no need to wait. You can refer them early. You can refer them while you're getting ready to treat them with other types of therapy. Rapid identification and referral of these patients really is necessary to get the best therapy set up. And then the final R I thought was really important, to receive patients returning after CAR T cells. The treatment centers have expertise in giving the CAR T cells. They're often far removed from the community centers. And we believe the intent should be to streamline but maintain communication between the community center and the center with CAR T cell expertise so that the treatment center can provide education. It should provide communication and updates and be ready to send the patient back to their community center. And that community center should at least have the knowledge at that point and be ready to receive the patient back after they've gotten the CAR T cells, know what to look for, know how to manage some of the longer term CAR T cell side effects that may develop. So relapse, every age or comorbidity, caregiver support early, urgency to recommend consult, and receive patients returning after CAR T cells. If they recur, you should refer.
Thank you for joining us on Cancer Buzz, Dr. Porter. We have links in the show notes for more resources on CAR T cell therapy. This episode was made possible with support by Kite Pharma. Until next time, for the Cancer Buzz team, I'm Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.